Hello, Mr. Yoda. I'm going to be your nurse. My name is Kara. I'm going to be your nurse this evening. Can I have you identify your name and date of birth for me? Mr. Yoda, 9577. Okay, thank you. So it looks like the doctor has prescribed warfarin or Coumadin for you. Basically, it's just an anticoagulant or a blood thinner. And this patient's taking warfarin for prevention of thrombotic events because he does have prosthetic heart valves. Let's go ahead and assess before we give the medication. So, Mr. Yoda, are you throwing up any blood? Have you been coughing up blood? No. Are you actively bleeding anywhere? Okay, good. Now, if the patient was actively bleeding, we would have to hold this medication. Doesn't look like he has any active bleeding. I've already taken a look at his labs, but some of the labs you're going to want to monitor are his PT, INRs, hemoglobin, and platelets. Make sure those are within range, and his are all within range. The platelets are between 150 and 400. The prothrombin time is between 11 and 13 and a half seconds. INR is maintained between 2 and 3, and his hemoglobin is between 12 and 16. So we're good on that. As far as vitals, we're going to want to monitor for tachycardia and hypotension. So we're going to monitor heart rate and blood pressure. Let's go ahead and do blood pressure. For video's sake, we're using this, but you always want to choose the correct size blood pressure cuff for your patient. Okay. Blood pressure's within normal range. We're going to check the heart rate now. Okay, heart rate is within normal limits. Heart rate is 75. Blood pressure 110/75, so we're good there. It's safe to administer the medication. So before we do, we're going to make sure to check the 5 rights against the MAR and the medication against the MAR. So, Mr. Yoda, identify your name and date of birth one more time for me. 9577, Mr. Yoda. Okay, thank you. It's warfarin. It's by mouth, and we're giving it in the evening. It's currently 8 p.m. So, Mr. Yoda, we're going to start you off at an initial dose of 2 milligrams and every day after 4 milligrams. The dosing is based off of the INR, PT, and INR labs, so we do have to collect those labs, make sure that those are within therapeutic range. And whenever you do take this medication, you're going to want to take it every day, once daily at the same time. So if we're giving it 8 o'clock now, we can take it 8 o'clock every day, every night. You don't have to take it with or without. You can take it with or without food. It's up to you. Just make sure to monitor for any signs, adverse effects, because it can cause increased risk for bleeding. So with that, you're going to want to use an electric razor, a soft bristled toothbrush to prevent bleeding in your gums. Avoid over-the-counter meds like aspirin or any NSAIDs like ibuprofen, because that can also increase your risk for bleeding, for excessive bleeding. Avoid alcohol. Make sure you consume vitamin K, not too much, but include it in your diet. And with your hypotension, it can cause really bad hypotension, so you want to make sure that you get up slowly in the mornings, dangle your feet before you get out of bed. Monitor for signs of toxicity. If you do have these signs, call your medical provider, your healthcare provider immediately. Signs can include bloody urine, bloody stool, or if you're vomiting or coughing up blood. The antidote is vitamin K, so you would be provided with that, but make sure to notify your healthcare provider immediately if you have those. And the way we can know that this medication is working for Mr. Yoda is by looking at his labs. They'll all be maintained within level. INRs between 2 and 3, hemoglobin between 12 and 16, platelets between 150 to 400,000, and prothrombins time between 11 and 13.5 seconds.